So good afternoon, everybody, and thank you, Dr. Parijat, for this nice introduction. And I know it is hard to, be awake after lunch, but let's see, I'll try my best. So basically, I talk on this non-invasive optical sensor for health monitoring. It's a device perspective. This is a kind of a quick story which would like to share with you as to how we have tried to develop a non-invasive optoelectronic device which works as a hemoglobin detector. What are the challenges? What was the way in which this entire journey has happened? What are the things that we found out? How is it that we uncovered multiple things as we went ahead? And what is the way in which finally we could come to a logical conclusion about what things are possible and what things are not possible. So entire thing is about that. So as Dr. Parijat said, I work as a professor in DIAT. It's a Defense Institute of Advanced Technology. Those who are from India will know it's a DRDO's organization, Defense Research and Development Organization. I work here as the Dean of Research also and also Director of International Affairs. I have my own startup company called Navyukti Innovations Private Limited. So this story is a combined story of DIIT and Navyukti together. So this is the team. A small part of the team you can see. So you can see here, and then every behind every one student we have one or two interns, and we have MTech students doing their dissertations. We are well supported by, of course, DRDO, and along with that, we get funding from DST, also with BRNS and ISRO, and so on. So the domain in which my group does research is basically on sensors. We work on different aspects of sensors for healthcare, sensors for drug delivery applications, chemical and biological hazard diagnostics. So CBW, as we call it in the language of DRDO, it's chemical and biological warfare diagnostics. So we work on extremely low compositions of ppm, ppb concentrations of hazardous gases and biological moieties, and trying to detect them by using indigenous sensors that we try to develop. And then we work, a good amount of our group's component works on sensors for robotic applications. So there we work on pressure sensors, haptic sensors, which are used to have a particular activity of a robotic arm for multiple environments, typically hostile environments where humans cannot go. If there a robot has to go and do some explosive handling, for example, then we develop sensors for the gripper. So these are the areas in which we work. Essentially, everything comes to materials. Everything is basically starts from a material, and then you realize the material to cater to a particular application, and then you try to make it better and better by using machine learning and things like that. So this is a company which is incubated in DIIT called the Navyukti Innovations. It is still crawling. It's not even walking. We are still struggling to make this company, really profitable. So these are some of the pictures which talk about the way in which technologies have been developed by our group with time. So the first one is basically a technology which was developed called as drug delivery device for wound healing applications. So this is a mandate which was given to us by DRDO, that if there is a bullet wound, not a normal wound like a scratch wound or anything, but if there is a very heavy wound in which blood is profusely coming out, then what is the way in which you can cater to such wounds? So we had developed nanomaterials patches, in which these were nanocapsules in which the drug was embedded, and these powders were synthesized and they were given to the DRDO fraternity for the bullet wounds, and so that the drug is released from it for around 72 hours, because that is minimum time that the soldier will take to go to a nearest possible place where he can get the medical aid. So this was something that we had done. We delivered this technology to a company called to the DRDO lab called Debel, which is in Bangalore. After that, as we just heard a lecture of Pragya Yadav, This was during the COVID time. So during COVID times, DRDO developed multiple solutions, out of which our group developed a solution called Ananya. This was basically antimicrobial and antifungal solution. We had used silver nanoparticles, which you have been listening to throughout the day, silver and gold nanoparticles. So we had used silver nanoparticles as their antimicrobial activity was explored. They were synthesized using a green root, and they were used to, disinfect the multiple areas, typically large areas such as hospitals, such as railway stations, transport areas, and all those bigger places, even company environments. We gave this technology to a company called Kinetic Green and also to Venus Safety and Healthcare Private Limited. So I'm quickly telling this to you because how the startup got developed, and since this is Industry 5.0 session, I thought this is timely to tell. After that, we developed a technology called Silvo Kavach, during which the company was born, and we gave this technology to a company called Vaishvik Biochem Private Limited. Sorry, it was an LLP. This was in 2021. And from then on, we started working on hemoprobe. Since I've come from a physics background and a physics and electronics background, we thought that instead of working on hardcore chemistry, it's good to work on optics and, something in which I'm pretty comfortable. So these are the pictures. You can see the Firodia group. We gave the technology to Firodia as it is kinetic green. This is given to the healthcare solution providers. That was a prototype of hemoprobe. I'll come to that. So drug delivery, I don't need to tell the gathering here as to what all things are required, but what we have done is, when you think of drug delivery, sustained drug delivery, stimuli, painless delivery, all these we use multiple kind of materials: chitosan, pullulan, then borax, polyvinyl alcohol, mesoporous materials. Stimuli-based release was implemented, and that's how the technology was later on handed over to Debel. Okay, so that's about this. And this is Ananya, as I told you. Okay, so I'm just going fast. The company was formed by multiple people. So along with me, we had somebody with a marketing expertise, somebody from core research, and we also had doctors, clinicians with us. We also had people who were good in designs. The device designers, they were also in the team. So as we go ahead, I'll tell this to you. So I'll just go fast. So we did this work. So this is a story of anemia, basically detection of anemia by using an optoelectronic. So we all know Anemia Mukt Bharat is one of the biggest slogans of India. We have a vision that in next few years, we should be having nobody suffering from anemia. So under this, we have the rural health services to be catered through diagnostics to reduce the India's burden on anemia. So not going much into the details, it's a negative cycle in which normally people run in our country. So normally if we have an anemic mother, so anemic people in India are around 63%. And in that, women are around 54 to 55% of Indian women are anemic. So it's a very big number. And if you have a mother to be anemic, then the child is also anemic. If the child is anemic, the child may not survive. Or if it survives, then it is not a healthy child. Then you also have that child to be not, becoming smarter enough to be better a citizen, and then it becomes a negative cycle. So impacting pregnant women and infants is one of the major things which happens in our country. Effects such as low birth weight babies and growth retardation is one of the major issues. So that's a major health problem. So 614 million prevalence of anemia in India. That is what WHO analysis tells us. So it's a huge Indian market, and though we talk about research, though even today I will also talk about multiple efforts that are being done in our country to handle anemia, we do not have an indigenous product in our country to non-invasively detect anemia or detect the hemoglobin level in a patient. So the hemoglobin testing market is huge all over the world. It is supposed to grow also. So if you consider only the semi-urban areas, the total market is around 600 crore Indian rupees per year. And of course, we are not doing very well in terms of this Indian scenario of indigenous sensor development. So we all are customers. So what is it that we are looking for, or what is it that we have tried to address? So these are some of the tenets. So we want to do some analysis in which there is no blood coming out from a patient. Not even a single drop of blood should come out. It should be a simple pulse oximeter kind of a device. That's what we have done. So it's a simple clamp like device, and on that we should be able to get the hemoglobin level. That's what was our mandate. So it should have no pain, no fear, no pain, no venipuncture is required, no blood should come out. It has to be an economical device, an indigenous device. It should have no secondary infections, because if you have a small child, like small children, which we saw on the lecture before lunch, those kind of small infant babies, if you keep on taking out blood out of those patients, it's a misery. So if you are able, and then of course that is also good for such small infants. And then you have secondary infection and tertiary infections and so on. Thalassemia is one type of condition in which you need to check the blood quantity and quality after every definite duration of time, when the blood itself in the patient is very less. So under those conditions, we want to have a device which will have no blood taken out, and therefore there will be no secondary infections. Furthermore, you don't want the syringe to be used all the time. So you take out the syringe, you use it as a plastic material, you throw it away because it's one time use, whatever it is. So you generate large amount of environmental hazard. So that also, if we can reduce, that should be good. We don't want any analytes to be used, any chemicals to be used, any pathological setup to be used, so that you are able to use less and less amount of chemicals. So chemical free, and it should be expertise free. I should be able to do it by myself. A small child should be able to do by himself. It has to be a point of care device, an over the counter available device, and it should give the data very fast. So this is what something that we had planned and we tried to work on. So we developed a prototype. I'll come to the details of it as we go ahead. But basically it comprises of LEDs on one side. They have some specific lambda values, an opto detector on the other side. Then of course you have a microcontroller to store the data, to process the data. And then we have used Python programming to program the entire way in which this entire process would work. And then you have to display it. You can also send it via Bluetooth. You can send it to wherever hospital and so on and so forth. So entire that process we have implemented. So this is a team. Along with me, we have Dr. Aarti Kirikar. She is a Vijay Medical College. She is a professor there, and she's a dean of that particular hospital, medical college. Mr. Satish Gokhale, he's a director of industrial design. He works on the product design, specialized with medical designs. AR Medical Devices and Services, we took their help for testing, because testing forms a very big part of the entire work. Of course, we have students and postdocs, and one of them, Dr. Vedashri, is just sitting here. She's also part of the technical team. So I'll not go into movie at all. So we have done some preliminary testing using the small device, and then we went to multiple small areas and workshops and hospitals to evaluate the data. Okay, after we did that, we have come to a specific level. So as I come to that level, I just thought of quickly recapping and trying to say as to what all has been done inside that device. So when we go back to the basics, from there we started. So this entire device works on the basis of Beer-Lambert's law. Okay, so that's a law which basically tells us about photoplethysmography, that is PPG. So what is PPG? It is basically an optical technique. It is used to detect the volumetric change in the blood. When the light passes through the blood, it is absorbed. So there is a systole and there is a diastole. So during the systole, you'll have the absorbance, and during the diastole, you'll have the absorbance. So using those two values and using the basic parameters of blood, you will be able to find out using the Beer-Lambert's law what is the absorbance. Okay. The effect occurs in the arteries, and the absorbance of light in tissues and arteries will either increase in systole phase or it will decrease in the diastole phase. And then you have that as a basic equation. So the equation is given as A is equal to epsilon Cl. Epsilon is the absorbance. Now, I mean, A is the absorbance. Epsilon is the molar coefficient of the blood. Molar concentration, how much concentration is what is considered in the systole or a diastole stage, and what is the optical length? That is, what is the length, what is the distance through which it is trying to get the information. So that's what is Beer-Lambert's law. There you can see the finger there, and then you have LEDs on the top, and then you have a diode on the other end. So this is the transmission mode. You can also use the reflectance mode. So hemoglobin is basically a measurement which is defined by oxygen dissolved in the blood based on the detection of oxygenated hemoglobin and deoxygenated hemoglobin. So HbO2 and Hb. Now HbO2 is absorbed more in the infrared regime and Hb is absorbed more in the red regime. So that's what is shown by that graph there. So therefore, if you have to find out Hb of a patient, then you have to look into the absorbance at two different wavelengths. One is the infrared and the other is red. So that is what we have used here. So we have used either 900 nanometers and the 660 nanometers. We'll slightly change these numbers later on. But in those ballpark, we have used red and IR. And then we calculate the amount of absorbance during the systole, diastole, systole, diastole. So that's what is done. And then, as I told you, you can use two different modes. We have used the transmittance. Once you do that, then you find out the optical density, which is the AC component over the DC component. And now the numbers we have slightly modified. So one is at 660 nanometers and the other is at 940 nanometers. So AC is the alternating current which sits on the basic DC. So that DC is DC 660 or DC 940. And when you have those fluctuations, that is AC. Okay. So we'll all remember this because I will come to this equation and try to tell you as to how complicated, though it looks very simple, how complicated it becomes as you go ahead. So when we do this, practically these measurements relate to the ratio and perform linear fit on this operation. Relation is established. So we feel it to be very simple that I'll just find out the AC component, DC component for every patient. And I'll take this ratio, I'll get 4 values. I put in a matrix and I'll get the value of HB. It's well documented in the literature. Okay, so we did that and we tried to get the HB value. So let's see what all has happened. So this was our setup. Of course, later on after the detector part, we require a signal conditioner, we require ADCs, we require multiple things, and then we use a microcontroller to store the data. To latch the data, we used MATLAB initially, and then we processed it using the Python programming. This was the type of a prototype it was initially looking like, and we had taken a commercially available pulse oximeter. We removed the circuitry from outside and we had used that clamp and put our circuit inside. So the problem that happened was there is a parameter which is of highest importance when we do this data logging, and that is called as perfusion index. So perfusion index is basically a ratio of the pulsating blood to non-pulsating static blood flow. Okay. So I have to quickly tell you that if the person is having a very steady DC value, then the value of HB that you get is very precise. Okay. But if your DC value itself is not very stable, then you have lot of problems. Okay, so that denominator value of DC is important. So the stable non-pulsating blood data is crucially required. Otherwise, you start getting this data wrong. Okay, in order to do that, you may require good filters and you may require good models to fit the data. So what do we do? So we take the LED's output. Okay, so depending upon our pulse rate, we will collect the data. So let's say we take the data for 15 seconds. So in 15 seconds, I collect the data from one LED. After that, I switch the LED. 15 seconds, I collect the other data and I keep on doing that and keep on latching the data. The more the data value I take, the better is the analysis. So I take it and I put it with the opto detector, that is OPT 101. The data is read, and from that, using some literature survey, we are able to say that what is a perfusion index. So if the perfusion index is more than 1.24, then you can display the data. And if it is less, then you have to say that, okay, you have to visit to the hospital because your data is not optimum. The value is not good enough. So this was basically the kind of a algorithm that we followed. And we did many things here. So low accuracy. So these were the practical considerations, data logging and all those things. It has to be portable. So these are some things that we have used. So this was actual circuit diagram that was used. The product testing was done. And then we plotted multiple graph of how the refractive index can be modeled, so on and so forth. So what is it that we found? So what we found is quite interesting. So here, this is a data of actual patients. So the actual patient was subjected to our device, and on the other side, we also did the path analysis, because that's our gold standard. So the blood was taken, the data was calculated, HB was found out, and what is it that we get? So you can find that the red point and the black point are near around. They have no specific thing because these are all different patients. Okay, so that thing has no meaning. The accuracy was very good. We got it to be around 95%, and it was a very happy situation. We were quite happy that we are able to get it very, very well. So that's what, and then further we did the entire, so we started using the machine learning algorithms. So we started training the algorithms by taking more and more data, and we started to fit in more and more data. So that's about the schematic and the PCB design. That's the actual device which we had, and it was showing the data in a perfect fashion. Okay. Now there are small things which happen. Practically, I'm telling you that when you use that small clip, in which you put the finger. Now, if that clip is exactly parallel to each other, those points, then you get a very correct data. But if it is not, and if it is like a clamp, the alignment of probably red filter versus the infrared may not be exactly the same. And then the type of signal conditioners that you may then require may change. Okay, that is point number one. Point number two, if the finger is very thin, the value of L changes. If it is thick, the value of L changes. So these are small errors which we started understanding as we went ahead, and we found out that pulse oximeter clamp is okay, but it is not perfect for this kind of application. So we started to do our own box design, and we prepared one compartment and the other compartment. So the electronics compartment had some LEDs, as you all know, microcontrollers. When we switch them on, there is some small green LED lighting somewhere. Okay. Now that started obstructing the data that you get. So we created a partition in between. I'm telling all these things because for the younger students, you may want to know what are the small things which come as hurdle, and then you feel that it is not so easy to convert a prototype into a product. So these are those small things. So then we divided it into two. One is electronics box and the other is optical box. And then we tried to make something which will come, the detector will come and sit directly on the top of the finger. However, the electronics communication, the electronics wires became more cumbersome. So all these things kept happening, and we tried to improve the design as much possible. And then we started to work on the machine learning algorithm. So we tried multiple of them, and we found out that everything is going to give us some kind of score. So the highest score is supposed to be the best. So we found out that this random forest gave us the better score, and so we went with it. Okay. So now these are the equations. So you can see the equations which are fitted in, the R square values and the data which is put up here. But you see this data doesn't look very great. Okay. It has got a lot of points which are going haywire. So we were worried about it, and eventually we found out that if the HB value is very low, if the patient is really very anemic, we were not able to get exact values. Okay. We were very, very good in the middle range and in the higher range, but low values we were not able to get very well. So what was the reason we tried to see? So I'll just show you this small thing which will run, and you'll understand what the point is. So this is basically the PPG graph that is trying to come when you are putting the probe there. Okay. So just see how it goes. So as you can see, this waveform is way too random. Time ho gaya. So it is way too random. Okay. So if you see this, then you are not able to derive anything from this. So this was a problem. So to explain you quickly, wherever you have a minima in first part of the time, at the same point you may have a maxima at some other time. Okay, and then if you average it out, you will get the best data for an average patient whose HB is in the range of 12 to 14. But if you really want to find out what exact value of it for a low HB patient, this data was not good enough. Okay, so we had to do something about it. So we don't have much time, but I will quickly try to go there. So we try to use some filters. Okay. Yeah. So when we try to use some filters, we started getting the data better. Okay, now this data looks much better as compared to what we got. So we tried to use some better filters, and then we started modifying the electronics. The electronics was modified. And then we realized one more thing. I'll not take much time because the presentation is big. So I'll tell you. So basically the graph that you get has a dichrotic notch. Okay, the PPG has a dichrotic notch. And this dichrotic notch has its own importance when you do the calculation. And if this dichrotic notch is not captured properly, your data will give you huge amount of error. We faced this problem and we tried to solve this problem by using large different type of bandpass filters. And that's what this discussion is. So this discussion, I don't have much time to explain, but we took a large amount of data to choose an appropriate filter. And that is that notch that I'm trying to tell you about. Okay. And then when we did the analysis, at the end only I'll show you. You can see the dichrotic notch emerging very well. So we had to work quite a lot to get this notch, this small notch that you are able to see. That helped us in doing the calculations. So I'll just go ahead because this had a lot of things. And then we did some signal quality indexing and then much amount of data analysis and so on. And finally, we could come to an accuracy of around 85 to 87%. So we were at 95%. We had to come down because of the practical considerations. And then we realized, so these are all boxes that we made. And, we finally built a box which looks like this with a horizontal loading of the electron. And that's all. So basically, I want to stop here. But basically, what I want to tell you is that this is the kind of journey that we have gone through. Today also I cannot say because with 85% we cannot be very sure that it is acceptable in the market. So we have to yet do large amount of analysis with the patients which are really thalassemic or having really low HP, and then only we will be able to positively bring it in the market. However, what I have learned is that there are a lot of lessons that we have learned. I'll not say much, but our Raksha Mantri had visited us, Rajnath Singh ji. So we had tested his hemoglobin using our prototype. And luckily for us, or whatever we can say, his value was perfect. And he had just gone through pandemic. He had COVID. And after COVID, I think around after 8 to 10 days, he had visited us. And he said that I know my HB value. I'm hoping that it comes correct. I was also hoping and it came exactly perfect. I'll not tell his HB value though, but it was perfectly correct and we were happy about it. This is a patent that we have generated and that's it. Thank you. Thank you so much.